Determine what you're being asked. And this speaks to exactly the point that just came up. If your ABCs are relevant, that's great, but sometimes they're not. So what kind of instances are your ABCs going to be relevant?
Emergent.
Yeah, so the emergent folks is when you're really breaking it down to airway, breathing, and circulation. So if it doesn't apply, it doesn't apply. One of the things that we learn is always to look for airway first, right? The answer is always airway. Well, it's not if they're already mechanically ventilated, for example. Like, it's secure, move on. Or if the question is actively asking about Crohn's disease and there's no airway issue. Airway, one of your assessments might be assess respiratory status. But for Crohn's, unless there's something else in there, you're actually not worried about that. Which thing will cause mortality if I don't teach it well, if I don't do it well? So for a lot of your prioritization questions, it's going to come down to like, who's going to die the fastest if I don't get in there? Or who's going to have some kind of mortality and morbidity issue that I'm not going to be able to reverse if I don't get in there. So sometimes it just comes down to urgent versus non-urgent. And then to prioritize which lab value is out of range. So we're going to get a chance to look at one of those in a minute too. Let's see. Have I picked on everybody officially?
I haven't done a question.
Whitney. All right. A client with cerebral edema after a motor vehicle accident opens eyes to noise, grunts when the nurse asks questions, and withdraws from painful stimuli. After administering dexamethasone, the nurse monitors the client for what therapeutic response? All right, so walk us through the choices.
All right, so A, both the client's feet and hands curl to the middle. So I'm thinking that's decorticate posturing, and I don't think that's a therapeutic response.
That would be the exact opposite of therapeutic response. You are right.
The client sleeps through the next peripheral blood draw. That doesn't really tell me. I mean, I guess it could be therapeutic because maybe they're sleeping and maybe they're not in pain, or maybe they're not sleeping and getting to be unresponsive. I don't know. So I'm just going to put that's not therapeutic in my opinion. The client states pain level is blue on a 1 to 10 scale. Well, blue is not on a 1 to 10 scale, but the client is speaking now versus grunting. So that's something that's different. That's a change. So I'm going to put a question by that, a star. The nurse must open the client's eyelids to check pupils. So my thinking, if a client, initially they were opening their eyes to noise, grunting when asked questions, and withdrawing from a painful stimulus. B and D are kind of the opposite effect of what they were doing initially. And C is opposite, but it's opposite, I guess, in a positive way, because instead of grunting now, they're actually verbalizing something. So I'm going to go with C.
C is your final answer. What y'all think?
Mm-hmm.
Yeah. So even though it's not the ideal response, it's a response. And every other option is literally moving the opposite direction so that we're not getting a therapeutic response. The patient's actually getting progressively worse.